Well, I mean, I would assume that most of your new patients come from word of mouth, having seen work you've done on a friend or family member.
Right.
So they've already seen your work. I guess, do we call it your work?
Right.
I guess. And I would assume that they're coming in and they'll want something comparable.
And then what you need to do is explain to those people, if they bring up the example of the patient that they were referred by, you can talk a little bit about body types because everyone's different. Everyone. I mean, you bring a Hummer into a body shop and you tell somebody, I want you to make it a Corvette.
Well, let's talk about that, because now you have people who are going through significant weight loss, and you see the shows now with the celebrities.
Right.
And someone's losing 100 pounds. And now after they lose all this weight, their bodies are left in a condition that requires
a lot of skin.
A lot of surgery. You get involved in that?
Yes. That, by far, is probably one of the biggest procedures that I do, is the post-bariatric or the post-major weight loss skin excisions, to give people more of a body contour rather than the hanging skin. It's a relatively new phenomenon. Bariatric surgery is, in the last 10 years, has really taken off, probably the last 7. It's very important that you find somebody who's trained in all the aspects of that surgery, because scar placement is very, very critical.
So you have to specifically ask questions about what sort of training.
Absolutely.
You have specifically with that.
Right. Somebody who trained 15, 20 years ago may not have all the modalities or the knowledge of what we've learned today. I mean, when I trained, bariatric surgery was huge, and so we had a lot of influx of those patients into the fellowship program. And so, and the fellowship is important because you get to see preoperative, postoperative, and complications. The more complications you deal with, the better apt you are to deal with anything that happens in your own private practice. So if you're seeing a lot of these patients and you understand the complications and you understand what causes these complications, you kind of stay away from that area or those situations while you're doing the surgery. And that's why the fellowship is important.
What do you think about these shows? I mean, now you look at on cable or satellite and you see, the celebrity, or the Swan was a show.
Both good and bad. Okay.
What's the one in Beverly Hills?
90. I'm not sure.
Yeah. Well, you know what I'm talking about. I mean,
well, it's both good and bad. It's good because it allows people to understand what's available, what can be done, how things are done. It gives people a little basis of knowledge. At the same time, you have to be aware that this is entertainment. I mean, it wouldn't sell if it was cut and dry.
It's edited to entertain.
To entertain. And a lot of the physicians are characters, They have personalities.
Well, they bring their personal lives into like the show that you were mentioning. I can't remember the name of it either.
90210.
Is that what it is?
I don't know.
Wasn't that another show?
Dr. 90210.
Dr. 91210?
I think so.
I don't know. But anyway, but they bring the doctors' personal lives, the wife, the kids.
Right.
This one's into karate. This one's trying to reunite with his father. It's entertaining.
Yeah, it's meant to be totally entertaining.
And then they cut to the doctor examining the patient and trying to find out whether he can meet those expectations.
I think the shows are both good and bad. Good because, like what I said before, that it allows people to see what's available, and bad because if you hang on every word, you're not getting the full extent of it. You see recovery periods within a half hour of the show. They don't. People don't understand. It takes
3 minutes later,
to
it'll just show you, 6 weeks later, and here she is at the unveiling.
So,
what about the understanding or expectation people have regarding, or lack of understanding regarding, the lifespan of some of these procedures?
Well, lifespan, again, there's a lot of variables, depending on your diet.
Well, you said baby boomers. So say a woman who's 50 years old, and she wants to have a tummy tuck, and she wants to have, implants or you would think I would know all these things, but the lift
Okay. Breast lift.
procedure. You know, well, she's got many years left to live.
Right.
How long is all this going to last?
Well, it depends.
Depends.
Again, on the variables. And the variables are your ability to heal. Do you smoke? Your condition of the area that we're correcting.
Genetics?
Genetics. How was that area before you even, you know, if you were sun ravaged, your skin's not going to have the elasticity.
Right.
But you take a healthy person and, you know, you give a breast augmentation and minus any pregnancies or excessive weight gain or weight loss, and without any complications, we'll take breast augmentation. You could have a good 12, 13 years.
And then what? You need.
You're going to age the way you would normally age. So gravity's going to take place. You're going to have loss of underlying fat. You're going to have loss of skin elasticity. You're going to have some drooping, or what we call ptosis. And you wouldn't have to go through as an involved procedure as breast augmentation, but maybe you would need a lift. But you would need a lift anyway if you didn't do anything.
So far, we've been talking mostly about women. What about men? What common procedures do you see men request?
Men, a lot of with eyes, the puffiness under the eyes, the fullness on top of the eyelids, a lot of liposuction of the love handles, the belly, with men, it's more exercise and diet-resistant fatty areas. Women tend to come with a little bit more with the hormonal issues of fat or retention or fat weight gain.